if it affects more people, then of course we'll have more deaths and more hospitalized patients than we currently have, which we're already at maximum capacity. So it is a concerning development.
Dr. Victor Tess talking about mutated forms of COVID called variants that are now showing up, more dangerous for us and for our healthcare workers. Today, the city of Lubbock confirmed 117 new cases of COVID-19 and sadly another 4 deaths. As cases continue to rise here and across the country, the CDC is reporting a rise in cases caused by those COVID-19 variants, with several being reported here in Texas. KLBK's Alyssa Tay is joining us now. You spoke to a physician today. Why are they saying these new strains are so concerning?
Terry, viruses are constantly changing and new variants are expected to happen over time. Multiple COVID-19 variants are already circulating across the globe, but as we start to see more cases across the country, we could see more strain on our healthcare workers.
The coronavirus is mutating.
But viruses do not stay the same,
with different variants reported across the globe, like the UK variant, the South African variant, and the Brazilian variant.
In the United States, we've only detected the UK variant so far.
Across the nation, about 122 cases of the variant have been reported, with 3 here in the Lone Star State.
This variation is more infectious, so you'll see more people infected. It does not appear to have more severe infections.
Most researchers say the UK variant is about 2 times more infectious than the coronavirus we know now.
That's a big deal because the coronavirus that we have been dealing with all along has been very infectious to start with.
The UK variant will still come back as a positive test, but to test for the variant is a different process. The state randomly picks samples before moving to the next step.
They have to be tested at a facility that will submit the testing specimen if positive for further genotyping.
Testing positive for the variant still calls for the same treatment and requires the same amount of time in quarantine. But with the variant being so infectious, it wouldn't be a surprise if it was already in the hub city.
Our citizens around here tend to travel a lot, move around, so I anticipate that we will get it here at some point.
That's why our health experts say it's so important to wear your mask, social distance, and get your vaccine.
Dr. Tess adds getting vaccinated is the best way to prevent the coronavirus from mutating even further. And Terry, the CDC reports the Pfizer vaccine is effective against the UK variant.